Hi everyone, it's Mr. Sinti. Today I'd like to talk to you about something that's on a serious kind of a topic. It has to do with cardiovascular disease. And that's right, cardiovascular disease is something that should be pretty common to us, unfortunately, here in the United States and other developing countries, because sadly it's one of the leading causes of death. And so the numbers are maybe surprising. They're surprising to me. About 600,000, and that's a conservative number of people that die of cardiovascular disease in the US every year. It's one in every four people, so it's 25% of the deaths are from heart and from blood vessels. And this video is going to be a brief look at some of the major issues surrounding cardiovascular disease and some of the treatments, and I might add. And so the term heart disease is often used sort of interchangeably with the term cardiovascular disease. And so in this video, they can be considered the same thing. And so when you look at this map right here of the United States, I was sort of looking into some of the statistics here by the CDC. It's remarkable how, as you can see here in dark red, there's higher incidence of cardiovascular disease in particular regions of the United States, which is very suggestive. Again, this isn't a video discussing cardiovascular disease in terms of demographics or regions, but it certainly leads one to speculate on what some of the causal reasons are that these southern states are more heavily influenced by cardiovascular disease. And so I just wanted to address that. Some of the risk factors of cardiovascular disease is hypertension. So having high blood pressure, and again, you don't know you have high blood pressure unless you test it. And so high cholesterol, and again, there's studies coming out every day suggestive of the fact that cholesterol may not be as detrimental as it was once previously thought. But all things being equal, I would advise, I'm not a physician, but I would advise laying low on saturated fats and diets that are high in cholesterol, and have your LDL, low density lipoproteins, tested to make sure. Obviously, smoking is trouble, and no matter what system of the body you're talking about, but it's a complete risk factor for cardiovascular disease, so I'd cut that out. Now, diabetes type 1, there's nothing you can do about that. You're born with this, but type 2 diabetes is also a risk factor for heart disease. Being overweight, a poor diet, physically inactive. And so these are the things, in excessive alcohol use. These are the things that maybe we can consciously control. And I know it may, again, I don't want to preach, but it may be something that if you know that there's a history of heart disease or cardiovascular disease in your family, there might be a genetic disposition for increased opportunity to have this. And so maybe you would take these risk factors a little bit more seriously. Hopefully you would. Now, cardiovascular disease refers to basically a few different things, but what we're getting at mostly is that it involves a narrowing of blood vessels, and that has to do with the fact that when blood vessels are narrowed, it leads to the blockage of blood flow. And if this happens to be a blood vessel to the heart, it could lead to a heart attack, and if it's blood leading to the brain, it could actually result in a stroke. And so there's medications and things. This is, again, not a video about that, but there are medications, you might have heard of them, called statins in general, and they lower cholesterol, and they do that by interfering with an enzyme in the liver. And they also, some statins are able to reduce inflammation within the blood vessel, which reduces the formation of these plaques. So they're generally useful. So other heart conditions, other than plaque formation in the blood vessel, might affect valves, and I'm going to talk about that a little bit later in the video. And they also have to do with the rhythm of the heart, and I'm going to try to address that in a separate video entirely. Okay, but this is a picture of a human heart right here. And so, as you can see, the heart has major blood vessels leading in and out of it, but it also supplies itself with blood vessels called coronary arteries and veins. And so One of the major arteries leading out of the heart is the aorta, and that's pumping oxygenated blood from the left ventricle through the systemic circuit to the whole body. Sometimes the wall of the aorta is weakened, and if the myocardium is weakened, it can result in what's known as thoracic aortic aneurysm, and this could be serious because what happens in an aneurysm is that the vessel balloons and it becomes much wider and much larger than normal, and that weakens it, and so it's vulnerable to bursting and rupturing, and so that usually needs to be attended to in surgery. One of the biggest concerns that we have about cardiovascular disease are, I alluded to them earlier, are these blood vessels that actually feed the heart. And so the heart, again, obviously is pumping every day of our life, and it's pumping about 70 times a minute. And so it's really working hard. And so the very first organ that the heart pumps to, it's itself. And so the first branches, if you can see here in this diagram, when blood comes raging out of the aorta, it can be detoured over here. There's two branches that come off the aorta. There's the left coronary artery and then the right coronary artery, and that bifurcates into a network of blood vessels, both arteries and then again veins that will carry blood out. But it needs to feed the heart itself. And so these coronary arteries are really important. Again, emphasis on that. Let me come up here. I didn't mean to click that. I wanted to push this. These coronary arteries, which are evident right here, are really important because they're supplying blood to the heart muscle, the myocardium. And so that's critical. Here's a close-up of this. And as you can see, if a blockage occurs, like say plaque was building up, and again, this doesn't necessarily happen right away. This happens over the course of a lifetime. And so this plaque and fatty tissue begins to narrow an area, and if it becomes completely blocked, it's referred to as an occlusion. And so if it's completely blocked, that's going to stop the blood supply to the heart. And so that's going to result in the myocytes, or in other words, the cells, the muscle cells of the heart, to die. And that results in a heart attack. And the sadness is that those cells don't recuperate from that. And so there's going to be heart damage as a result of a heart attack. And so we don't want that to occur. We don't want an occlusion. This is a really cool image here. This is a normal heart, and the muscle's been removed, and this is just looking at the coronary arteries, and they've been treated with this special plastic. And you can really see the intricate network, sort of the branching, tree-like branching of the right and left coronary arteries, and seeing how they are able to articulate into all of these other smaller vessels feeding the heart. And so a heart attack, again, is the death of the cardiac muscle itself, and that results from a prolonged blockage. You don't want that of maybe one or two coronary arteries that supply oxygen-rich blood to the heart. And again, we refer to this fatty buildup in general as plaque inside the artery. And so it basically could be occurring in your body and you don't really even know it, because if some blood is getting by, you're probably dealing with it. But if it becomes completely blocked, it'll result in no oxygen to the myocardium below, and so this tissue right here dies, and that's a result of a heart attack. And again, this is a great picture of the coronary arteries feeding all of the capillaries that ultimately will provide oxygen to the myocytes and the myocardium. Now, this is a cross-section light micrograph of a coronary artery, and you can see here in this picture that the lumen of the vessel is obviously blocked, and so not a lot of blood is getting by. So in addition to the plaque, which is shown over here, you're seeing there's a blood clot right there. And so a lot of times what will happen is that the plaque will rupture, there's inflammation and damage to the tissue, which results in clotting factors. And so these clotting factors, this is a long story made short and simplified, but these clotting factors will form a blood clot. as they normally do, but this is not normal. So this big blockage right here, blood clot, is called a thrombus, and that clogs the coronary artery, and it could be blocking the blood completely or an occlusion. And that if that's to the heart, that's devastating, and if it's to the brain, that's devastating, because you don't want the brain to have a blockage. And so here you actually see the thrombus right here is where I'm picturing right here. You can actually see this clot blocking. Now, here's the thing about a thrombus. It's like, okay, maybe it's not in a coronary artery. This is not a coronary artery. And maybe it's not in the brain. And it's like, well, it's trouble wherever it is. But if it becomes dislodged, and in other words, it's flowing through the blood vessel, it may actually end up in a coronary artery or end up in a crucial blood vessel in the brain. And that results in a stroke, which is the definition of this is the death of nervous tissue in the brain. And I know this is a video about cardiovascular disease, but I have to bring this up because this thrombus can originate in another in another blood vessel in the body. And if it actually gets transported and moved along through the bloodstream, it's then referred to as an embolus. Okay, so the embolus can be moving around, and if it becomes the embolus, here it is, it finally becomes dislodged over here in the brain, it'll block the blood supply to this region of the brain, and then that will have results when that tissue dies. The person may have permanent damage as a result and possibly die as a result of the stroke. It depends on where the blockage is in the brain and if it's caught fast enough. And you can have dissolving agents to sort of break this loose if it's caught early enough. Okay, and so this embolus is basically moving around. So the blood clot breaks off and it moves from the plaque buildup in the carotid artery, which is here in the neck, and it goes up and eventually lodged itself in the brain, causing this stroke to occur. So the effects of a stroke and the individual's chance of survival really depends on the extent and the location of the brain damage and if it's caught early enough. So that's important. Here again is a look at the plaque and then a thrombus right here, which is then totally blocking or occluding blood from flowing into the area. And then anything downstream of this, any tissue is going to be deprived of oxygen and die. Okay, so the fact that a heart attack and a stroke are sometimes thought of as being sudden, like, oh my God, he's having a heart attack. It seems to come on, but that, in fact, it belays the fact that the artery of the victim has probably been gradually impaired by chronic, meaning ongoing cardiovascular disease over the course of many years and maybe many decades. And so this sort of slow buildup of plaque in this is a picture of a normal artery. You can see the endothelium and you can see the smooth muscle right here in the big bore of the lumen of the artery. And here you can see right here plaque developing. And so this is known as atherosclerosis. In other words, these growths right in here that I'm drawing right in here is referred to as a plaque. And that develops obviously on the inner wall of the artery, narrowing its bore. And so blood is still going through. And so you don't know that you have that necessarily, this atherosclerosis. And so it's a specific type of arterial sclerosis. And there's a difference, and I'll try to identify the differences, subtle between them. But basically they're somewhat interchangeable depending on how far you want to go with this. But atherosclerosis, as I was mentioning, is this buildup of fatty tissue, often cholesterol. It's accumulating, and then sometimes there's rupture to the tissue, and then more platelets come in here, and they start releasing clotting factors, and there's more fibrin that forms, and then more cells get caught up there, more LDL, low-density lipoproteins start to form, and then you start getting this mess, this plaque basically, is what we're talking about. And then this restricts blood flow, and it narrows the bore of the artery. And so the plaque site, the smooth muscle layer of the artery, can even thicken abnormally, and it becomes damaged, and then there's more fibrous connective tissue involved, and you get collagen fibers, and you get lipids building up and cholesterol building up. It's quite a quite an ordeal. And then in some cases the plaque becomes even hard because of calcium. There's calcium circulating in the blood as well. This is known as arteriosclerosis. Okay, so this is the true hardening of the arteries as a result of calcium buildup in particular. Okay, so hopefully that was clear. Now, I say that it comes on suddenly, and it's like, oh, you're having a heart attack. And so generally what happens is when the heart is clogged like that, there's a threat of a heart attack or a stroke. But maybe there might be some warning signs. In other words, when it's partially blocked, sometimes patients feel strong, heavy pressure in the chest, known as angina pectoris, or just angina for short, meaning that there's a pressure being put on the pectoral muscle right here. Sometimes people experience it in the shoulder or in the arm a little bit, but it's a pressure, and it's not normal, and it's not something that is typical of just a normal cramp or I'm feeling a little sore. This angina is serious, and at that point, and again, I don't want to be too much of advising you what to do, but at that point, if you're experiencing this pressure, especially when the heart's laboring like this, there's no hesitation in my mind that one needs to call the emergency response system and get some help, 911. Okay, so then again, some people may not be experiencing any warning signs, and they're unaware that the disease is even about to happen. But these are the typical sort of experiences of angina, meaning like pain in the chest and the arm, sometimes even in the jaw. It's very very strong. Sometimes there's some dizziness, some lightheadedness, some sweating. Again, affecting your breathing, maybe some heartburn. All of this, increased heart rate, are symptoms of angina and potentially heart disease. What I find kind of interesting about these coronary arteries is that sometimes you hear that a high saturated diet and cholesterol and lack of exercise, these are sometimes things associated with modern lifestyle. But lately, we've been able to take mummies, of all things, and put them through a CT scan. And these are all different locations, like an Egyptian mummy. And it turns out that we have the ability to look at arteriosclerosis in the heart of some of these mummies. And so it's not completely clear whether or not they died of a heart attack. And it's somewhat suggestive of the fact that maybe these mummies were of importance. Maybe they're eating a high meat diet with saturated fats and cholesterol. There's a lot of interesting conversation that can go around mummies having heart disease. And so what are some of the treatments of heart disease? Well, I'm going to talk a little bit about angioplasty. And so basically, there's something called a cardiac catheterization, or cardiac cath as it's clinically normally referred to. And it's a procedure that can examine the inside of your heart, and it's using special x-rays called angiograms. Okay, and so there's a dye associated with this as well. And so as you can see here, here's a picture of a coronary artery, and the dye helps to contrast on the screen. And when there's no dye, it appears as like a narrowing occurs. And so this is where the blockage is. And so the dye is visible by these special x-rays that are and then shot on the body, and the dye is injected into the body, in the blood, obviously, and through a hollow tube called a catheter. And so the catheter is then able to be moved up through the abdominal aorta all the way to the aortic arch, and you can inject dye from this catheter directly into the coronary arteries right there, and you can actually see them on the screen. And you can see right here where no dye is able to pass is where the narrowing is. And so this is in the cath lab, a cardiac catheterization, and you can look up on the screen right here. And so here's a physician putting in the catheter inside the leg and then working it all up. It usually enters down in here. Here's the insertion site right down here in the femoral artery, and it's worked all the way up the abdominal aorta, up into the aorta itself. And again, there's all sorts of equipment. This is one that I thought was pretty cool, the C-arm right here, fluoroscopy. And like this enables you to take a look on the screen. And so the physicians are actually looking up on the monitor and noticing where the blockage is right there. And so this procedure, as I was referring to, is called angioplasty, and there's a particular type of angioplasty called balloon angioplasty. And so I want to sort of take a break from the notes just for a second and see if I can show you something here. Maybe not easily. Let's go here. Come over here. So here's an animation of balloon angioplasty, and let me start it over here. So as I was mentioning before, a catheter insertion occurs here in the femoral artery, and then it travels up into the aorta. Okay, and so we're going all the way up into the heart right there. Okay, and so there's a coronary stent, which is a tiny wire mesh that ultimately is going to be put inside this coronary artery. But before that occurs, this is what happens. So here is the angiogram. In other words, the X-ray view that the surgeon would be looking at, noticing like, oh, there is a blockage right here in the coronary artery. And so there's the blockage that we were talking about. Here's the atherosclerosis plaque that is reducing blood flow, which is increasing the possibility of the heart attack. And so what happens is the first thing that they'll put in there is a guide wire, and that comes in, and it's able to then you insert with the catheter a balloon, and that guide wire helps you to sort of push it along, and then the balloon is inflated, and it crushes the plaque backwards. Let me see if I can repeat that. So there it is, and it's increased, so the balloon is inflated, and it pushes the plaque closer to the wall of the lumen. Now, this is the way angioplasty was normally performed, but then it was thought that maybe if we then add a stent, in other words, the balloon is put in, and then this stent is this mesh wire that actually keeps the artery open longer, and it helps it from clogging up again. And so the stent is then deployed. And then what's interesting about the stent, there's different kinds, but some of them are actually treated with drugs that it will actually reduce further plaque formation, and then also release some chemicals that will reduce inflammation. And so these are permanently positioned inside the heart. And so that stays in there, these stents in balloon angioplasty. So I find that to be totally interesting. And so here it is. The catheter is put into the artery, and again, the balloon fills up, and the catheter is equipped with a tiny balloon that's inserted into the artery. Again, this is all being looked up on the screen, and then it's inflated, and then it's removed, and the artery is then open. And here's a picture of the balloon inflated. So it crushes the fatty plaque deposits, so therefore it improves the blood flow, and therefore when the stent is left behind, it helps to keep the blood vessel open completely. So that's balloon angioplasty. And again, here's the buildup, and then the stent comes in, it's inflated, and then the balloon is removed, and then the stent expands, and it stays inside. Pretty cool. Now, one way that we can view some troubles of the heart, and in particular, we can look at troubles of the valves of the heart, is something called an echocardiogram. And so this transthoracic echocardiogram, or TTE, or just simply cardio ultrasound. You might be familiar with ultrasound, where a transducer shoots sound waves down at the heart, and then you can actually see in real time the valves. Here's the tricuspid and the bicuspid or mitral valves. You can actually see them in operation. So the echocardiograph uses a transducer probe that's placed right onto the chest, and the subject is that you're able to see live images of the heart pumping. And so there's specialized forms of this. There's something called the transesophageal echo, or TEE. And then this is particularly important when you're in surgery. You can actually take this and actually feed it through the patient's mouth and go all the way down the esophagus. And the camera basically, or the sound wave generator, is basically sitting right next to the heart. So this transesophageal echo is really important. You can really get some great images. Like, check this out. Like, this is a picture of the mitral valve, and as it turns out, one of the things about cardiovascular diseases, this mitral valve is always kind of, first to go. It's working really hard on the left side of the heart, and so here's an image right there. And so as it turns out, there's three basic things that can happen when it comes to the valves of the heart. They can regurgitate or backflow. They can harden, or stenosis, or atresia is an instance where there's actually there's a closure where the valve is supposed to be. And so let me discuss these briefly. So this regurgitation, backflow, occurs if the valve doesn't close tightly, and I think that kind of makes sense. If you don't close the door, there's going to be a leak, and so the blood leaks back into the chambers rather than flowing forward. And this can be a problem. In the United States, this backflow is often due to prolapse. A prolapse is when the flaps bulge back in the upper part of the chamber during the heartbeat, and it affects mostly the mitral valve, as you can see here in this imaging right in here. So regurgitation is a problem. Stenosis, I mentioned, where they become stiff. As you can see here, there's a stiffening of the mitral valve right in here, and you can see it over here in the echo. And so this prevents the heart valve from fully opening when it's stiff like that, and so not enough blood flow goes through the valves, and sometimes they can have both stenosis and regurgitation problems. Here's a actual picture of the atrial valve. So this is a semilunar valve ejecting blood out the aorta, and here you can see this is a degenerative type of stenosis, or hardening of the valves. Now this could be treated, and again, I'm not a physician. This could be treated by, maybe it needs to be completely removed. Maybe there needs to be a mechanical valve put into its place, or maybe a cadaver replacement valve needs to be put in. For valve surgery is what we're talking about. And atresia, again, is when the valve lacks an opening. You can see here, here's a closed tricuspid valve, and so that's a problem. Okay, and so there can be a variety of valve disorders. And so in general, this video on cardiovascular disease looked mostly at heart attacks, and as a result of arteriosclerosis and atherosclerosis and arteriosclerosis and plaque buildup, and it talked a little bit about balloon angioplasty and some other issues with valves. So I hope this was informative. I hope it wasn't too sad. It's not meant to be that way. But basically, it's an awareness that hopefully leads us to a lifestyle change. Hopefully it motivates us to have some sympathy for those that have cardiovascular disease. And basically, it's a rally call for us to become more involved in medicine so that we can each contribute in our own way to help society live a healthy life. Okay, thanks for watching.